Millions of women suffer from painful uterine fibroids, and many believe their only option is to get a hysterectomy. But a new FDA-approved procedure could eliminate the need for invasive surgery for many, and Michelle was eager to try it out.
I was first diagnosed with fibroids when I was pregnant. Over the years, the fibroids have grown to such size that they are now pressing on my bladder.
Our patient today, Michelle, actually has a uterus the size of a 5-month pregnancy.
I travel a lot for work. I also have a very active daughter and very much part of all of her activities. And so for a hysterectomy, I felt like the complications were just not something I wanted to deal with, but I had to make a decision.
The procedure is called the Acessa procedure, an outpatient procedure, minimally invasive, and it allows treatment of fibroids in just 2 small incisions.
I thought this is the alternative. This is the way I want to go and get my fibroids finally treated.
These are obvious fibroid tumors here. That one's about 6 centimeters. That's the uterus with other tumors around it as well. So we're in good shape to proceed with the procedure. And you can see me rotating the needle there, and that's the needle within the tumor. Okay, so now we're going to go ahead and ablate it. First, I'm going to deploy the electrode array inside the tumor. We're just going to hit this once for 2 minutes. And now you'll see that the tumor is now beginning to blanch as the blood supply is decreased. The tissue becomes white. I also designed in this needle the ability to coagulate the tract, and that stops the bleeding. And we're finished. So that myoma is now thoroughly ablated, and we are free to move on to the next.
And joining us now is Michelle and Dr. Bruce Lee, who created the procedure you just saw. And as I always like to do, Michelle, how many days out are you from this?
Just 4 days.
And how are you feeling?
I feel great. I feel really good.
From the field of a gynecologist, this is huge news for women. And I think the first thing that women listening need to understand is that just because you have fibroids does not mean they require treatment. Michelle, in your case, when we hear 5-month pregnancy size equivalent of your uterus, that's affecting your quality of life. So just because someone tells you you have a fibroid doesn't mean you need to go rolling off to the operating room, number one. You should ask your gynecologist, because usually we're the ones who are seeing these women first. Give me all the options. I have never done this procedure, so I would be telling my patients, go see Dr. Lee or someone who you've trained, because this is huge. This can be a game changer.
So what kind of women are
This is a game
candidates
changer.
with fibroids for this type of procedure?
Well, any woman who has symptomatic fibroids, who wants to preserve her uterus, who wants a minimally invasive procedure allowing her to get back to work in several days, a cosmetic procedure with 2 very small incisions, 5 millimeter and 10 millimeters, who wants to has experienced very little postoperative pain. Michelle didn't take a single pain pill of any kind after her procedure. She is walking very, very well. She's already experiencing a change in some of her symptomatology and an improvement. And again, in May, she's going to run a half marathon.
That's amazing. So, and just so that you guys understand, you know, Dr. Lee and I know there are a lot of different surgeries that you can treat fibroids. Some of them are done through the vagina, called hysteroscopic myomectomies. It all depends where the fibroid is and how large it is. Some of them, in the old days, big incision, one of the bloodiest operations that we have in gynecology, called an abdominal myomectomy, and then laparoscopically. But what I love about this surgery is it cuts off the blood supply, it kills that fibroid, and there isn't the blood loss, the scarring, the things that we see with all of these other operations.
Is there a chance
Absolutely.
of recurrence, or is it pretty much treated?
Once we treat that tumor, it will not recur.
And
It's
we,
called the
The Acessa procedure.
Acessa procedure, and we're going to have more information on this procedure on our website, thedoctorstv.com, because it seems to me that this
it's
could be
a
a game
very
changer.
important option.